Good afternoon, good evening, and perhaps even good morning to all who have signed in to the Canadian IDDSI Implementation Forum. Thank you for joining us today for this webinar. We're thrilled to be able to spend the next hour with you, telling you a bit more about implementation, especially in the Canadian setting. First of all, we'd like to just inform everyone that all webinar participants will be in a listen-only mode. If you have any questions, click on the Q&A button in the middle of your menu bar, and you will be able to submit a question that we can address and answer towards the end of the session. The session is being recorded so that it can be available for rebroadcast and will be available on the IDDSI website for anyone that you know who may not have been able to attend today, who would like to listen to this broadcast. Following the webinar, a certificate of attendance will be sent to all those who have signed in and attended the webinar. And you will also be receiving a post-webinar survey that will be coming to you through your email tomorrow, and we would encourage that you please complete the survey and provide us with some of the input that we're asking for. We very much appreciate everyone taking their time to be here today, and we hope that you'll enjoy this webinar with us. First of all, we would like to thank the IDDSI sponsors. As you can see on the bottom of the screen here, we very much appreciate their unconditional support for the work of IDDSI to continue. And on the call today, we're happy to have with us Jan Duvestein, IDDSI board member, Katrina Steele, IDDSI board member, and as you can see on the screen, here are our disclosures. Again, as I mentioned, IDDSI receives funding from a variety of sources, and that's what allows us to continue to do our work that we do. So I'm now going to hand it over to Katrina so that we can get the webinar started.
Thanks, Peter, and good afternoon or good morning or good evening to everybody. So I'll be doing an introduction here, and I certainly hope this isn't the first time you've heard of IDDSI, as I say it. Peter's been saying IDDSI, and either of those works. Essentially, the overarching goal of the International Dysphagia Diet Standardization Initiative is to pursue safer meal times for individuals with dysphagia. And we are motivated by the reality that when we communicate a prescription or a recommendation for a certain diet texture, whether that be the food side or the fluid side of the recommendation, that unless people understand what we mean by the names that we use for those textures, that there's the potential for misinterpretation and the potential to deliver the wrong thing to the individual with dysphagia. And unfortunately, this is really a very serious safety risk. And so our goal is to pursue a safer mealtime environment. We can move to the next slide, please. So as I mentioned, unfortunately, this really is a safety risk, and it doesn't take much to look through coroner's reports and find examples of situations where people have received an inappropriate food or drink item. Food more is documented in coroner's reports, but we believe there's also a safety risk associated with delivering an incorrect fluid. The example shown on the slide is quite a recent example here in Ontario, where I live. It tells the story of an older woman who was documented to have dysphagia, who went to an emergency room for other reasons. And during the course of her visit in the emergency room, she was hungry and she asked whether she could have food. The documented diet on her chart indicated a need for pureed foods and regular liquids, and she was served the stereotypical Canadian egg salad sandwich and choked to death on the sandwich. And the reality is, and I'm sure this will come up later today, that when you look through coroner's reports, that really the number one food item that is implicated as a cause of death by choking is bread. Bread or meat that hasn't been properly chewed. And so we take this very seriously. And through the description of food textures and the development of testing methods, we hope to reduce the number of these cases and get the right food and right liquid to the individuals with dysphagia. We can go to the next slide. So the IDDSI framework was released just over a year ago in the Dysphagia Journal. And we, as a board of directors, decided last year to continue into a new phase of the project, which is to support implementation of this new framework and these new standards internationally. And so various countries are at different stages in terms of that implementation project. Here in Canada, we would characterize ourselves as being in a preparation stage of that implementation. And you can see on the slide various activities that show that different stakeholder groups are beginning to engage the material and move towards implementation. We had a very successful forum with industry partners and users last October. Several important professional associations and regulatory type bodies have committed to supporting the implementation of IDDSI as we move forward. Next slide, please. So when do we hope this will be achieved? Well, we are talking about a target date for implementation in Canada of next January the 1st. And so it's important to understand what that means when we say implementation. What this means is that the industry sector in Canada associated with the production and delivery of texture-modified foods or liquids for people with dysphagia has committed to having labeling on their products by January the 1st that will include IDDSI terminology and nomenclature. Those labels may be dual labels. They may represent both the old and the new, but they will represent the new and therefore will support users, whether those be hospital purchasing bodies or patients and their families or clinicians, to understand the properties of those products and to begin ordering them with the new IDDSI framework. And so that's a very important step towards uptake and implementation. We can move to the next slide. So what will this transition look like? On this slide, you can see what we call a currency converter that maps where we've been and where we're heading. So you can see here that the familiar labels of nectar thick, honey thick, and spoon thick liquids that came from the American National Dysphagia Diet will map, we expect very fairly easily, to the new IDDSI levels 2, 3, and 4 of mildly, moderately, and extremely thick liquids. And that there's a new level that falls between thin liquids and what you currently call nectar thick liquids that will be called slightly thick. This is a level of liquid that we believe has particular application for infant feeding, for infants with dysphagia, but possibly also for others. And you may have referred to this level of liquid before as a naturally thick liquid, although it wasn't formally in the National Dysphagia Diet. Next slide, please. In order to support you to map fluids that you use in your practice or in your facility to the new IDDSI levels, we've developed a flow test that documents fluids flowing through a standard 10 milliliter slip tip syringe, and after 10 seconds of flow, the height of the fluid that remains behind in the syringe is measured to determine which level that fluid falls into. Just want to highlight that it's very important that the correct syringe is used for this test. And what's critical is the length of the chamber from the 0 to the 10 milliliter line. And you can see on the left-hand side of the slide a guide here to say that that distance should be 61.5 millimeters long. Then when we go to mapping foods, sorry, Peter, you can go ahead. You can see the approximate mapping here from terminology that you might currently use in your facility. I would just comment that we've had an extraordinary variety of terminology for the food side in Canadian hospital kitchens and historically. And we really hope to map those to the levels on the right-hand side. And to point out just a couple of highlights here, I think probably the most important and one of the more challenging items is to comment that at level 6, soft and bite-sized, we really, for the reasons of safety and limiting choking risk, it's very important that the pieces of food at that level are already cut into bite-sized pieces or will be cut before serving to the patient. I think with that, I'll hand off, I believe, to Peter to talk about the steps that we believe will be needed to implement in your facilities.
Thank you very much, Katrina. A lot of people have actually approached IDDSI to say, well, how do I get started? And many IDDSI users are actually asking us to help prepare a guide, a timetable, a schedule. And so one of the things that we will have available for everyone very shortly is this IDDSI implementation, 10 simple steps to get started. And so as an overview, this next slide will illustrate the 10 steps that we're asking people to walk through. The actual PowerPoint presentation that we'll be sharing with you will actually have a bit more detail for each of these headings. So the first thing we would ask people to do, if you haven't already done so, is to have everyone become familiar with IDDSI. And so whether that is visiting our website or revisiting our website, because we have many more resources now available for everyone. And Jan will walk us through that in a little bit. And if you have not had a chance to download the IDDSI app, this is a really, really good time to do so, because in the near future, a lot of the communication and updates will also be coming out through the IDDSI app. So that's the first thing that we would ask people to do. Secondly, we know that it's very challenging and difficult to go at the implementation process alone. So we do request and suggest that people form a team, especially when you're working in a large organization, and perhaps multiple teams need to be formed with a steering team that helps to oversee the work that gets divided for a large organization. So number 2, form a team. And thirdly, I think, for people to know about IDDSI, we really appreciate the fact that all users of IDDSI help to spread the word. And so we have resources available on the website where there are print and post posters that we have designed for that purpose. And there will be more print materials that will be coming out, along with ready-to-use PowerPoint presentations in our resources section, as well as videos. Once we've done that, we would ask you to consider checking out the food and drinks. And so, as Katrina had mentioned before, this is where the mapping starts. We have had a lot of inquiries from users about how to even begin the mapping, and questions about, do I actually need to test every single product that I have on my menu? And the answer is, well, it really depends on how they actually map over to the IDDSI detailed description. And also, if you are working with foods that you're producing on your own, or are they foods that might have already been tested and recipes developed by organizations that you belong to, or purchasing groups that you belong to, or even manufacturers are now undergoing the process of testing foods and recipes, and are able to provide some of that information to help make the journey towards implementation a lot easier for everyone. So this is a really good time, if you haven't started to do so, to start looking at all the foods and drinks that are in your menu. Talk with the suppliers that you're working with, talk with the groups and organizations, your head office, and start to think about how to proceed with testing the foods and the drinks. And then bring the larger group of stakeholders together, number 5, where we ask people to convene, divide, and conquer. And it sounds like it's such a military term here, but it really isn't. The idea is that the more people you're able to get involved with the implementation process, the more buy-in that you're going to get. And if each small group handles a small piece of the work, it will definitely make the work much easier. And this is where having a steering team or an implementation task force team within your group will be very valuable in order to help to coordinate the work of convene, divide, and conquer. And once the work is done, come back together and do a bit of a check-in and a checkup. Because if we're aiming for that January 1st, 2019 implementation date, then we have a number of months to go where it may require us to actually come together and say, well, which recipes actually do work for us, and which ones do we need to look into again? And then really come back and take a look at the food and drinks that do require the modification. Because as far as you might be concerned, a number of items that are currently existing on the menus perhaps already match and pair over to the IDDSI terminology very, very nicely. And then at number 8, what we're asking people to do is actually to re-look at the implementation process from the perspective of the clinical assessment piece, because we have had many questions asking us about the use of bread, as Katrina had talked about earlier. What do we do with those? And what do we do with some of the easy to chew foods that may be in level 7 that people are currently getting now? There has been a great misunderstanding that if you implement IDDSI, then it means that these people can no longer have those foods. And that is actually a myth. And we want to clear that up by asking people to re-look at their assessment process to figure out how to actually accommodate people, and how that prescription for the texture modification and the liquid thickness actually gets written and communicated so that for those who actually can manage to eat sandwiches safely, those who can actually chew the meats safely will continue to do so. And we have stakeholders from all over the world working on the fact that IDDSI levels are actually being viewed as components of a meal rather than the full texture that's required for the entire meal that is identified. So I think this piece will require a number of people in different practices coming together and talking about how that actually can be done. And then finally, pulling it all together, setting some goals in terms of putting together a test location or a test period, just to make sure that the communication can be quite seamless. Then finally determining a date to launch, and all hands on deck and launch. So we wanted to share these 10 steps with you because we wanted people to see that yes, we can go about this in a systematic way, and users within Canada and in fact all over the world have been asking about how do we then do this in a much more coordinated fashion. So one of the things that the IDDSI board has come together to do is we have now put together an implementation guide that guides people through a 12-month period in some broad category areas, coordinating what needs to be done from a food service and catering perspective, as well as from a healthcare professional, clinician perspective, and also from a industry partner supporting the implementation perspective. So this next slide that I'm going to show you will be something that will be available on our IDDSI resources site very, very shortly. We're just in the final stages of polishing. So the implementation guide will in fact look something very similar to this, where you will see that there are 3 color bars that are going through each of the so-called tasks or item of reminder, and along the top we've identified the months to go, and this is a recommendation only for people, because some of these things you may have already been doing or have already done. And what we're hoping is that each of these little boxes that you see along the way can act as a checkbox and a checklist for you. What you see on the screen is a cross-sector master guide that shows you the coordination between the 3 areas that I have talked about. We will also have a separate set of implementation guide pages, which will be specific to food services and catering, specific to industry, and specific to clinicians and healthcare professionals. That really is just a segment of this master guide, but we wanted to show you that this is designed in such a way where it allows for the 3 areas to be very coordinated, working towards implementation. So here's another page that just shows you what tasks are suggested, and then when might be a good time to do this. So we're hoping that this will be helpful to all IDDSI users, and so look for this on our website very, very shortly. We will definitely make an announcement of this through our eBite newsletter, as well as posting a notice on our website. So please do check back regularly with regards to the new items that are available for you to use. So Jan, I think I'm going to hand that over to you now so that you can walk people through the resources we have available for them.
Okay, thanks very much, Peter. Alluded to the resources that we have, and I think this is one of the key ways in terms of implementation that we're going to be able to provide support around the world, because obviously we're a small team and can't be there to do all the implementation. So this is what I'm going to go into a little bit more detail and about some of our different pages and different resources. Next slide, please. Okay, perfect. So when you go, our resources can be found under the tab on the website, and we're absolutely happy. You can download these for free. We're very happy for you to use and share the resources, and you don't need to seek our permission, but we do ask you review and cite our Creative Commons license, which is listed on the landing page. Next slide. Once you click on the tab, if you've been to our site before, you might notice we've done a little bit of a makeover, and I suspect we'll be doing lots of more tweaking and makeovers as time goes by and our resources increase. So we've organized them into sections to try and make it easier to find what you need. And certainly, as I say, as we built up more and more resources, we found we needed to actually reorganize it to make it a little bit simpler for people to look at that. So we're going to dig into a few of those resources now. Next slide. So in the implementation, we've got a number of wonderful tools, and one of the newer ones, and I think incredibly useful tools that we have are our new IDDSI audit sheets that have been developed for each level of liquid and food. Next slide. Here's an example of one of them. This is for our minced and moist level 5 consistency. And the thing about it is that not only does it give you an opportunity to quickly look to see what the description of the criteria of what its appearance should look like and so forth, it also very clearly outlines very specific tests that need to be done. So when you're looking at your food mapping and looking at doing your checking and your QA on your menus and that, this is one of the tools that will be very useful. You'll notice we've included things like time of service, 15 minutes after the serving, and 30 minutes, because we do know that that food and liquids can change when they've been sitting for a while. So this is going to be, I think, a really important tool that will be useful not only for the initial implementation, but also going forward for QA. Next slide, please. We've also developed labels that you can easily download, and those can be used on things like menu cards, diet boards, to help very quickly identify the specific diet requirements for any particular patient or resident that you're working with. Next slide. The other thing that we realized is that we need to have some kind of abbreviations for the food service computer software, because many large organizations certainly use this kind of software, and obviously the length of the terms don't always fit into the space that the computer programs have. So next slide. Here are the abbreviations that we spent some time developing, and this was done with input from health providers, food services staff, and IT. It was a fair bit of thought put into them, making sure that we didn't use any sort of abbreviations that could be misconstrued for another medical term at all. And so this is the final list, and again, these are suitable for use, and hopefully as you're going forward with your IT people, they'll find that a useful tool to have available. Next slide. We also recognize that often, and particularly as you form your teams, that you are the folks that are going to be taking the lead on the implementation, and the need, as Peter put out there, to spread the word and to educate others, all kinds of levels of stakeholders. And this will roll right from the workers at the bottom all the way up through administrators, and perhaps even it may include government and ministers at the higher levels of health. And so in order to make it a little bit simpler, we've created a number of downloadable PowerPoint presentations. So you don't need to spend the time trying to pull those together. We've done the work for you, and you're welcome again to use those as you see fit, and present those to help with the spreading of word around. Next slide. The other thing we know is that government agencies and administrators, along with others, often want to know what is the evidence to support making this kind of change. And we recognize it is a change, and it is going to take effort and time and potentially cost to that as well. So what we have done is all our IDDSI publications are open access. They provide much of the evidence that is available for you to take, to use, to read, and to use in your presentations when you're trying to move forward with these initiatives. So those can be found under our publications link and subheading there, and you can be easily downloaded. Next slide. So I guess we like to think that a picture's worth 1,000 words, and perhaps we can say that a video's worth a couple of thousand these days. So we do have a link to a YouTube channel that have a number of helpful videos, and here is an example of some of our videos. These are some of our food testing videos, so they show the ways that you do that. We have those for the flow test, the IDDSI flow test, as well as a number of the different food levels. And we are working on more of these, so it's always a good link to press on and take a look and see if we've added any new ones to our YouTube channel. Next slide. Peter mentioned the IDDSI app and the importance of that, and here you can see is our app, and it is available for Android, iOS smartphones and tablets. So it is free, and we do encourage everybody to download this because it's a very handy tool, and it gives you quick and easy access to the information you might need right at the bedside or down in the food services area. And also is something to share with patients. People are pretty computer savvy these days, so they may be interested in having access to the app as well. Next slide. We're also extremely excited about our new webinar series, and some of you may have joined us. We had our very first session in February, and we had two excellent presenters from Children's Hospital of Orange County who shared their implementation process in a pediatric hospital. Our next and upcoming presenter is Chelsea Robb, a dietitian from New Brunswick, sharing her implementation story in a long-term care facility. So our goal is to try and provide some of these webinars, as we think they're great ways to share information and let people share their stories of how they've gone about it. And you know, it's always great not to have to reinvent the wheel, so hopefully people will have an opportunity to listen into these. We offer them in usually two different sessions of a repeat, and that is to, of course, think about our time zones around the world. If you can't get to either of those sessions, we are recording and posting those webinars on our website as well, so you will be able to freely watch those after the fact if necessary. Next slide, please. And kind of finally, last but hopefully not least, is because, as Peter mentioned, there's a lot of new stuff. We're working on these resources and things, new things coming up constantly. And so one of the ways that we try and share that is through our eBite. So if you go to our Contact Us tab and sign up for news and put your signature in there, you will be sent out generally about once a month, one of our e-bites, and we do try and highlight the newest things that are happening in that. Here's an example of our last February e-bite, and if you're on the already signed up, the March one will be coming out quite shortly. So we do encourage you to do this, and also if you've got something you'd like to share in terms of a story, think about emailing us with that and sharing your story on our website as well. I think I'm passing that on to Peter now.
Great, thank you very much, Jan. And so as Jan was talking about stories, we just wanted everyone to know that this is a time where we are calling you to actually share with us your successes, your challenges. Send us a photo, send us a short video, tell us what you've been doing with your menu testing, your recipe testing, and we would be more than happy to post those so that others can also learn from what you've done and perhaps get connected that way with you. there have been many requests from IDDSI users about, well, how do we connect with other IDDSI users? We're happy to announce that IDDSI has now formed a very, very wonderful partnership with the National Foundation of Swallowing Disorders. And in June, which is the National Dysphagia Month, supported by the NFOSD, we will be having a fun competition, actually, to have people share stories and videos about what they have done to help promote IDDSI terminology use. So watch out for more information with regards to that. And of course, as with any contest, there is a prize that you can win. We just wanted to give you a bit of a heads up. And so why don't you gather your information now and start to share some of those stories with us. And that's also an opportunity for others to know that you are actually implementing. If you don't have a story to tell us at this point, perhaps what you can do is just write in and let us know that you have started the IDDSI implementation process. We are in the process of updating a list, or generating a list, I should say, of all Canadian sites that are in the implementation process, so that people can then find and connect with each other that way. In the last webinar, we talked about the fact that in Ontario, there's a group in the long-term care sector that's actually gotten together to become an action group. And this group is working towards some common processes and discussing issues around the use of breads and sandwiches, and they, in the near future, are looking to actually send out a survey to IDDSI users across Canada to ask about what could we use as a common term or common assessment process to be able to determine if somebody is able to manage a sandwich or manage some of the soft, easy to chew meats in that level 7 category. And so that group is working towards that. And so by sharing some of those stories and having it captured in the e-bites and updates, that's how we can help from a global perspective of communicating that information with all of you that is currently following to see how to work with the implementation tools for IDDSI. So we're going to just taper off on the information that we're sharing from this webinar. But before I do that, I think it would only be appropriate to just once again acknowledge this wonderful group of volunteers from all over the world. And again, some of you may have met this group through other webinars or presentations, but we just really want to extend a warm thank you to every single one of these individuals from the different walks of life of and professions that support the work of IDDSI. So I just wanted to acknowledge them because none of us actually get paid anything for the work we do. We do this work because we are passionate about it, and we actually do it off the side of our desks. And we are reaching out now to the world, to you, the audience, for help. So please share your stories. Again, we don't care if it's a success story or if it's a challenge. And that way it allows for everyone to help participate and to make IDDSI an even better process for everybody. We are going to now take some questions from the audience. Again, just reminding you that if you have a question, please, if you don't mind, go to your menu bar and type in your question and send that over to us so that we can address it and share it with everyone. We have a number of questions that have come in at this point. We have a question that has come in from Daniela. Thank you for your question. And the question is, we are struggling with some of our pureed and minced products being sticky, especially products high in fiber and protein. Could you please elaborate on stickiness, is the first question, and would you have any suggestions for functional ingredients that you have come across that will help us reach the standard of non-sticky products more effectively? So, Katrina, Jan,
Who's going
anyone
to
want
take
to?
that?
Yeah.
I can take that, I think.
Okay.
So this is a good question to make people aware that when you go beyond level 4 on the framework, or even at level 4 on the framework, which is the extremely thick liquids and the pureed foods, the flow test no longer works. We've reached the saturation point on the flow test, and it's time to move over to the supplementary tests for food texture testing. And one of those tests is critical to this question, and it is the spoon tilt test. And so the test is to have a bolus-sized amount of the food on a spoon, to tilt the spoon, and to see whether it falls off in one cohesive bolus, and whether or not it leaves a sticky residue on the spoon. Daniela, I don't think I have a firm answer to how much qualifies as too much residue on the spoon. And I think there's actually a very similar question down a couple of people by Peter regarding how much lenience there is about stickiness. To say here that stickiness, of course, is an important property, and particularly if you're working with patients who might have xerostomia due to radiation or to certain medications. So I think, the guidance is, does it all fall off and how much is left behind? You can imagine something like peanut butter being very sticky. We also know clinically that paste barium that is sometimes used in video fluoroscopy is exceptionally sticky, and it actually sort of fails this test, if you will. It's not a good example of a level 4 liquid because it's so sticky. In terms of the second part of the question, do we have suggestions for ingredients? I'll probably defer to Peter here, other than to say that if you're looking at thickeners, there is emerging and increasing evidence that the xanthan gum-based thickeners are more slippery and less sticky than the starch-based thickeners, and so that may be of some help related to ingredients. Peter, do you?
Yeah, thanks, Katrina. I'll jump in here and talk about the functional ingredients. And so when it comes to minimizing or reducing the level of stickiness, two things are really should be considered. One of them being the moisture content of the product. We know that when products start to have moisture evaporate from it, if you think about the starch-based type items, that is typically when it would become more and more sticky over time. And so looking at the moisture content of the product that you're starting with could actually help with the final outcome of the texture modification. The other item or the other ingredient to think about is also the fat component in the actual item itself. What we have found is that, again, for some of those items that are incredibly sticky, particularly from a starch-based product, again, if there was some added fat to the product, it may actually help reduce the stickiness. And I think I'll also go on, Katrina, you were mentioning there's a question from Peter. Peter, thank you for the question. for manufacturers when developing products that pass the spoon tilt test, how much lenience is there for product that is partially stuck to the spoon? Should the spoon be completely clean, or is some residue okay? And that question, thank you, has come up several times to our communications email. And so what we've said to people is that when you do a spoon tilt test, if there is some product still stuck to the spoon, but you can generally see through what residue is left and see the spoon itself, then that small amount of residue is actually okay to be left on the spoon, because there are very, very few items that will completely come off the spoon and leave no residue. And again, those items are typically the items that have very, very high moisture content. So if you have a lot of product that is actually stuck on the spoon, and as Katrina mentioned, imagine peanut butter, where no matter what kind of effort you use to try to shake it off the spoon, there will be a large amount that remains on the spoon that doesn't allow for that bit of translucency so that you can still see the spoon behind the product. In that case, we would then say to you that that product is probably too sticky. Having said all of that, this is where we're encouraging people to also, again, look at the assessment process that you use for the individual, and can they actually manage certain levels of stickiness, because as Katrina had mentioned, it often will depend on how efficient their oral transport mechanism is, what the condition of the mouth is, and the level of xerostomia. So as a general testing method for stickiness, that spoon tilt test is a really good way to test, because we wanted a simple testing tool that can be used by industry, can be used by healthcare professionals, and can be used by patients in their own home just to easily check if something is too sticky. So we are currently also working with a couple of the renowned food scientists around the world in looking at the sort of more technical definition that we can provide down the road around stickiness from a food science perspective. And again, please be patient with us. As we mentioned, there's lots of work to be done ahead of us. And so at the meantime, the spoon tilt test is one where we're suggesting people use. So hope that that actually answers those questions. There is a question that's come in from Melissa, and it's specific to Ontario. And the question is in regards to implementation in Ontario. Can you comment on ministry support for IDDSI implementation? Will there be special funding available to allow this the implementation phase to occur? Melissa, we hate to disappoint you. No, not at this point. We would encourage for anyone on the call that has the ability to contact the ministry. Perhaps you can do this on IDDSI's behalf. What we can say to you is that the Ministry of Health in British Columbia did ask to meet with us, and we have met with them, and they are looking at issuing a statement of support for the IDDSI standards, and we're hoping that that can then be expanded to support from the various provincial Ministry of Health across the country. We really don't have influence over the ability for special funding, but again, if we can say you won't get if you don't ask, Melissa, perhaps you can be our first champion to reach out to the ministry in asking for what can be done from a provincial level to support implementation. So
Can I just add there, Peter,
Sure.
that the coroner's case that I mentioned at the beginning, there was actually a formal recommendation at the end of the coroner's case that organizations move towards IDDSI implementation and education. And we are aware that letters were actually sent to regulatory level and professional associations. And so that is perhaps a document you want to pull and use when the discussion comes up in your facility about the why should we do this. It may be of some help.
Okay, thank you, Katrina. And then there is a question from Sassy. Is the date January 1st, 2019 for a complete transition to IDDSI labeling, or can it be dual labeling? The answer is as long as there is a reference to the IDDSI terminology, we are happy if manufacturers wish to use a IDDSI only label or a dual label. We know that some manufacturers are now already using dual labeling to help with the whole preparation phase of IDDSI implementation. And again, it's not an exact science because of inventory management. So what we really are asking is that by January 1st, 2019, that all manufactured products at least carry the IDDSI labeling, whether it's just on its own or in a dual label. So hopefully that answers that question for you, Sassy. There's a question and comment, I think, from Martin. And the comment is, I've helped develop a puree sandwich which enables people with dysphagia to pick up the sandwich and feed themselves. You're asking for a fork to be served with pureed meal. Surely that's taking their dignity away, question mark. The comment, thank you, Martin, for working on a pureed sandwich. One of the things that we have determined, and again, this is based on coroner reports and the oral processing literature, is that if you were to be able to pick up a pureed item, this is where our concern is that that density of the pureed product or the cohesive nature of that product might have actually reformed that puree into a more solid form that could ultimately result in a choking risk. And so here's why we are recommending that the pureed item has this ability to fall off a spoon, and that a utensil actually is required to eat a product that's pureed. We have seen many reports where what is considered as a pureed product, an example being mashed potatoes, where the mashed potatoes, given the temperature change and the evaporation of the moisture content, has actually re-solidified, and people ultimately choke on the mashed potatoes. So, Martin, thank you for that comment. If you would like to share that story with us about your pureed sandwich, we would be most happy to, again, share that with other IDDSI users as well. So thank you very much for writing in that question.
Can I jump in on that, Peter? And just say that I was actually with a patient today who brought in what they called a minced sandwich from a nursing home facility. And effectively the crusts had been removed. And so I was able to explain to this patient and their family that the fork pressure test is important for confirming whether with simple pressure, just enough to blanch your thumbnail white, whether the fork would easily break that sandwich into particles that fit between the prongs of the fork. In this case, unfortunately, they didn't, and so my recommendation in that case was to remove the bread from that sandwich, which was really making it solid. So those, I think, are good examples.
Okay, thank you, Katrina. Then there is another question that has come in. I get questioned that if health authority regulations do not mandate the changes, then why do I want to invest/spend time on IDDSI? I try by saying that these are professional guidelines for excellence in the field and that I would like us as an organization to follow. Is there any information you can provide about mandatory implementation? How do I deal with resistance or objection? I am also struggling with resistance for adding more diets, textures to make. Thank you, Aisha, for sending in this question. There are a number of questions there. I think we'll try to address them one by one here. First of all, the question about health authority support. I think we had mentioned earlier, we have never said that implementation of IDDSI is mandatory, because we want people to adopt IDDSI because they know it's the right thing to do and not because it's something that they are mandated to do. We've seen failures of this with other national standards that have been developed that have been mandated, where the adoption rate is actually very, very low. However, it doesn't stop us then from reaching out to the health authorities. And the one example I mentioned earlier about what's happening in the Ministry of Health in British Columbia is the fact that one of the health authorities actually did reach out to the provincial government in saying, is this something that you would support? Because once they get a statement of support from the Ministry of Health, then they feel this is something that we would then need to, or they would then need to move on to support and adopt. And we're so happy to say that that's what's happening in terms of the ministry within British Columbia. So perhaps we can ask the same of listeners and webinar attenders from all over Canada to reach out to their provincial associations and their health authorities, and as well to their ministries of health, to ask about the adoption of IDDSI. And as Katrina mentioned earlier, that coroner report is a very, very strong document to be able to support that. The other thing to do is look at the publications that have been done in terms of the first publication from IDDSI, the need for international terminology. Prior to the start of IDDSI, I was working on the collection of data for Canadian terminology that was being used. And even at that point, back in 2012, what we discovered was that there was a huge confusion in terms of the terms that were used for across the country. And that's actually what prompted us into wanting to develop a Canadian national standard. But the project just somehow evolved into, well, why develop another national standard when we could start looking at collaborating and forming and developing an international standard? And that's how we actually got to the place that we're at now with IDDSI. So we would ask that, for your help to reach out. In regards to the question about the resistance for adding more diets and textures, perhaps we can clear up that misunderstanding. We are not asking every site to add every level of the IDDSI diet recommendations or, in the descriptors. If you are currently not using one of the levels from IDDSI, then don't add that to your current menus. People have been asking us, well, do I need to provide a liquidized diet? Some people have asked, well, do I actually need to provide that slightly thick level? And again, if there is no need for it in your site, then we would suggest that you don't add that to your diet levels. Add only the ones that you need. And to sort of further go on, to further explain about what you want to have on your menu and not on your menu, people have also asked us, well, does that mean that I need to then remove all the other therapeutics that I currently have on my menu that may not match IDDSI terminology directly? And the answer we've given people is no, please don't. If you are wishing to keep a certain diet level that you currently are using that does not match with IDDSI, then just make sure that you identify it as so. And unless all of the descriptions and behavior of that product match IDDSI, we ask you then to not call it an IDDSI level to prevent any confusion. So hopefully that answers that particular question for you.
Peter, can I tackle the one before that?
Sure.
So this is another question from Sassy, and I think it's an important one. It talks about testing thickened liquids that really are right at the upper margin of level 3, so that a few drops come out of the syringe over 10 seconds, but really there's still 10 milliliters left in the syringe at the end. And Sassy, it looks like you've done the appropriate thing by then moving over to the spoon, tilt, and fork drip tests with that item. And you say that there might be a case where it actually doesn't test as a clear level 4. But it's really a very thick level 3, if you will. And I think this just illustrates that across the continuum of thickened liquids that we have, they're not all going to fall nicely in the middle of each level, and there will be some that are approaching the boundaries of the levels that we've set. And so there are really 2 comments there. One is that might be too thick, and if it were a product that you were thickening yourselves, that would be a case where you might want to consider modifying the amount of thickener to fall more solidly into level 3, or to add more thickener to see if you can get it more solidly into level 4, if that is your goal. That's the kind of activity that we're aware is actually going on with the manufacturers. So some of the manufacturer products are testing sort of on the margin. And over time, as they determine what to call the liquid, we're aware that some reformulation may be going on. So hopefully over time, we will end up with fewer of these items that straddle the boundary. I hope that answers the question. Over to you, Peter.
We have a couple of more questions. Thank you, Katrina, for answering those. Judy from the Ontario Society of Nutrition Management has just written to let us know that there is a survey on the OS&M website that has questions on it, asking for facts for implementation, so that that data that is collected could help perhaps get some support from the ministry. So the OS&M website is osnm.org. Judy, thank you very much. Judy Kirby is the president of OS&M. Thank you for sharing that information with us. For those who can contribute to that survey and provide some facts, thank you. That's a great step forward in trying to get some information to talk to the Ministry of Health in Ontario. And then finally, we have a question from Tim. Tim asks, I was curious on the tolerance for particulates in a pureed product that contains skin, husks, for example, from peas, corn, or should these products be avoided altogether?
I can take that if you want.
So,
or Jan, why don't you
Jan,
take
go
it?
ahead. Yeah.
sure. Okay, thanks. So the definition and the kind of criteria around puree is that, in fact, that it is smooth and does not contain skins and husks. And so the idea being is that it's really intended for someone who would struggle with that kind of texture in it. So you would want to make sure that those are not part of that. Again, sometimes there are some individuals who perhaps can manage a slightly higher level in certain capacity. And again, I think that then becomes a bit of a clinical discussion. I would hand it over to Peter to comment on whether there were some methods of ensuring that some of those husks and skins can be removed from things like peas and corns to achieve that consistency.
Thanks, Jan. And the honest truth is, unless we have really commercial grade type choppers and blenders, it's actually really, really tough to be removing and be able to modify the texture of peas and corn and anything with a thick skin down to a point where it's absolutely smooth. We know that many of our commercial partners are able to do it simply because of the machinery that they have. Does that mean that we should avoid all these products together? The answer really is no. I think, as Jan, as you mentioned, we need to go back and think about, well, why is it that we want somebody on a smooth pureed diet? And is it because we need to provide them with something that is a ready to swallow bolus, or is this just because of a sensory aversion? We've seen in some individuals where little pieces of anything within a puree is detected, and those get picked out, and then that particular food is rejected. Or is it truly a swallow physiological issue where the small bits that are in the pureed products, because they're particulate, actually gets left behind? And so when it comes to texture modification for peas, corn, anything with husks in it, some cooks have tried to work with trying to cook these products longer to see if they could actually soften the skin from the peas and corn. But again, there is no sort of concrete answer back to you, Tim, at this point, but to say, well, one, consider why the pureed is being prescribed for that individual, and can they offer it? But under the IDDSI terminology and definitions, we're saying no skins, no husks, no particulates, from a physiological perspective of not having that become a residue that becomes an aspiration risk. Katrina, do you want to expand on that anymore?
No, I think you've covered it. And I think it points to the fact that the framework is intended for people with dysphagia. It may have items and descriptors on it that fit for people who don't have dysphagia but require some texture modification for other reasons. But that building your diets for people with dysphagia within the constraints of the definitions is, we believe, the best way to pursue safety.
Wonderful. Thank you. So those are all the questions that we have received. We once again remind everybody to please fill out the survey that will be coming your way in an email tomorrow. We thank you for joining the IDDSI Canadian IDDSI Implementation Forum. We look forward to receiving comments, stories from you. Again, stories@iddsi.org. Please check back on our website and look at the notice that will be coming through the IDDSI eBites for upcoming webinars. So thank you very much, everyone, for joining us today. We wish you a wonderful afternoon, evening, or even morning, depending on where you are in the world. And thank you for making IDDSI truly international. So have a great day. Bye-bye.
Bye, everybody.